Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, here again with Dr. Millicent Rovelo. Millicent, what's going on?
Not a whole lot. Hanging out with you, doing our podcast.
Ready to talk about revision rhinoplasty?
Always.
This is a huge topic.
It is. It's a long one.
Well, it doesn't have to be, but I think it's going to be.
It might be, yeah. But it's good. It's a big topic, and we got to tackle it, so let's do it.
Well, diving right in, revision rhinoplasty is when you've already had a rhinoplasty. You've had some kind of nasal operation to improve the look of your nose, or the airway, I guess, could be part of it, and you're not happy, and you need more surgery to fix it.
Right. So you've either, like you said, had the surgery before for cosmetic reasons or for airway obstruction, and something about it is still not quite right. And it can range, right? It could be a functional thing because you can't breathe, or you might just not like how it looks, or both.
Or both. And, and there are people that have first-time revisions, second-time revisions, third-time revisions. Other terms that people use is secondary rhinoplasty or tertiary rhinoplasty. I use the term heptenary rhinoplasty at this time, which would be 7.
What is your highest number of revision?
14.
Oh.
I think that's a Tertiary
rhinoplasty. 14's a hefty amount.
It's a lot. And it was a guy that really... his nose was demolished, and he should not have been having more surgery per se, except that his breathing was so bad and the look was so bad, and there were answers to make it better, which we did. But I think the key to understand with revision rhinoplasty is that you have to have clear-cut goals for what you're trying to achieve. And the communication between surgeon and patient is essential to getting through this.
I think that's true for all rhinoplasties, but for sure when you're coming in with a revision rhinoplasty, because there are a lot of obstacles and you have to be organized about which ones you can realistically address and fix and which ones are way down on that list of things that you can address.
So I see a lot of patients for this. It's probably, 50% of my practice is revision rhinoplasty, and probably 35% is primary rhinoplasty, and then the other stuff fits in the other 15%. But the revisions that I do are often for problems that I think could have been avoided at the primary rhinoplasty. The first most common thing in my practice is what I call the completion revision rhinoplasty, where you're kind of finishing off the primary. It's just that things didn't get done enough. They didn't get the hump down enough. They didn't get enough definition at the tip. They didn't shorten it enough. And by the way, that happens to me too in primary rhinoplasty, where one of my most common reasons to revise a rhinoplasty is I didn't shorten the nose enough and rotate it enough. I'm so paranoid of creating a pig nose that I would rather have to trim a little bit more off the septum and not deal with it looking piggy, because lengthening is a whole different animal, right?
It's easier to make it a little bit shorter than to try and make it longer and flatter. Yeah.
And that definitely falls into the completion rhinoplasty category. I also see the underdone hump, where you just haven't taken it down enough. Now, I don't want ski slopes, but at the same time, people want to get rid of the hump.
Right, that's what they went in for. They want the hump done. Yeah.
They want it smaller. I very rarely have seen a patient who's like, I really want my nose a lot bigger. Have you ever seen that?
No, I can't say that I have.
What about in the world of revisions for you? If you have to pick how you're going to get it done, what's one of the cartilage sources? Because a lot of times these people have lost their septum, right?
Usually at the first primary rhinoplasty, someone's taken their septum.
Worked on it.
Done something to it. So that middle part, the cartilage that's in the middle of your nose, it separates the two halves, that's your septum. And that's frequently harvested, or something's been done to it at the time of the first rhinoplasty. And so that is typically a source of grafts that you use in the nose for support and to open it up or to restructure it. And so when that's gone, you have to look for other sources of cartilage to rebuild the nose.
Right. So this is really key, because in secondary rhinoplasty, you've only got a few choices left if the septum's gone.
Right.